Hey guys, welcome back to my YouTube channel. Today we're going to be going over sleep function. We're just going to go over like tips and tricks, things to remember, just a review. Okay, bringing it back to anatomy, sleep is controlled by the hypothalamus. The hypothalamus has the pineal gland in it. The pineal gland secretes melatonin, as in I'm going to turn and go to sleep. It's regulated by the sun, so when it gets darker outside, the solar rays goes down, and then it tells your body to release melatonin. This is very much from anatomy. Wake up, you release cortisol, sol as in the solar rays outside, which is why people are most supposedly awake and active the first few hours of waking up, because your body produces cortisol. Remember that the brainstem is breathing. The brainstem is located like in the back of your head, but later when we talk about sleep disorders, this is going to be important, so just remember brainstem, breathing. We have 4 stages of sleep. We have N1, N2, N3, and REM sleep. Each one of them is a different stage of sleep. You go through the stages multiple times through the night. N1 is the lightest form of sleep. You're basically dozing off. Ever been going to sleep and then you had like a random like jump scare out of nowhere and you're like, I don't know where this came from? N2 phase, which is the longest stage. Let me repeat, guys. Longest stage of sleep is N2. This is when we're going to start seeing vital signs decrease, so heart rate decreases, your temperature drops. You really start to go into a more deeper sleep. As deep, and I'm just going deeper. And I'll put up a chart that's really used, but it's basically like going up and down, up and down. And 3 is the deepest stage. So it's not the longest, but it is the deepest stage. This is when you repair your body, not your brain, your body. So this is going to be like tissue repair. This is going to be like if I work out and I'm sore, this N3 is going to repair. N3 repair, N3 repair. Just remember that. You're going to see a lot of questions over older people. Older people, as they get older, they get less of N3. So if it's going to ask you a question, be like, what's a normal process? I'll go over questions at the end of this, but basically just know older people get less of N3 sleep, deep delta N3. Remember that. REM sleep. This is about 20% of your entire sleep, but it is so important. REM, rapid eye movement sleep. You have an EEG, so what we said before was delta. Well, this one is going to show very, very similar to like when you are awake. This is where you vivid dream. So if you're waking up, and also if you remember your dream, so like you wake up and you immediately remember your dream and you just know what happened, you most likely woke up in REM sleep. It's really interesting, actually. We won't go too much into it, but this stage is really important for brain and cognition and memory. So we said before, N3 is very much for body repair, protein synthesis, that kind of thing. Now we're going to go to REM sleep, which is important for brain function. And just think that you dream using your brain, and that's what it helps with. So cognition, memory, no muscle movement. Your body, it says, cannot initiate muscle movement, no muscle movement. It's a form of protection because you are dreaming, that you're not like flailing your limbs around if you have a nightmare or walking around. So you cannot move your body in this phase. Reiterating myself, any questions you see about vivid dreaming, any questions you see about cognition, memory, and it's going to ask you what phase you're in. REM sleep, rapid eye movement. Now we're going to go into sleep disorders. The first one is insomnia, which is the most common. Honestly, I would bet we all have insomnia. The amount of people I know taking like Benadryl every night, taking melatonin every night, it's a very common disorder. There is a lot of reasons, like we said before, like the hypothalamus, how it regulates the light and the dark cycle. Well, it's your circadian rhythm. Your circadian rhythm is a 12-hour clock, and it basically, 24-hour clock, my bad. And it's basically based on how consistent you are. If you go to the bed every night at 8 p.m. and you wake up at 6 a.m., your circadian rhythm is going to be good. You're going to feel well rested, and you're less likely to have insomnia. However, if you are constantly going to bed at different times, you have a weird work schedule, it's less likely to be good, and you're going to feel less well rested. People say to really utilize this kind of this kind of rhythm. Like, you want to use it to your benefit because it helps you so much, especially when you're waking up and you have that cortisol being resolved. It's the best time to study, it's the best time to whatever. But if you're not getting that because you have a bad sleep schedule, then like sucks for you, you know what I mean? Okay, so, and how do you assess insomnia? Well, the number one is just subjective. I'm coming in and I have a problem, I have a sleep diary. You can do a sleep diary, but basically you're gonna listen to your patient. If your patient is, hey, I don't sleep, yeah, let's believe them. I don't think anyone's gonna lie about like not sleeping. That's the number one. There is a few, I'll add them right there. There is a few different scans and like things you could do to like prove that you aren't sleeping enough, but like honestly, normally just subjective data, being tired all the time, not being able to fall asleep like immediately, taking a long time, morning headaches, all of that. And we're gonna go over sleep hygiene in a second, of things that can help you sleep, and then symptoms that you'll see when you don't sleep. Versus acute. Chronic is more than 3 months. So somebody has chronic insomnia more than 3 months. Medications that can be used are benzos, Pam. Have you ever watched The Office? Benzos are only used for short-term use. But anyways, benzos are always ending in Pam. So if you see a Pam, Pam, it's a benzo. Remember that. The one that can be used for low dose for elderly, which you might see a lot, and it can be used for long-term use, is trazodone. I actually have this, BRB. Oh, I'm gonna have to flip it. But yeah, trazodone, my mom takes this, and she's been taking it for years, so she's a little older. I wouldn't say she's elderly, but she's definitely older. Okay, and then we're gonna go into sleep apnea. So sleep apnea, there's two forms, OSA and a central nervous system sleep apnea. Basically, OSA is an obstruction of something. So like, why did I just put my tongue out? But basically, like if you're laying back, people say this is what you're not supposed to do when you have OSA. When you lay back, your tongue flips and it also can block your airway. Using ATI will say you can't breathe for 10 seconds or more. So like there's a time limit. Just remember, like 10 seconds of not breathing is OSA or sleep apnea. Central nervous system, which this goes back to what I said earlier, brainstem. This is an issue with your brainstem, issue with your central nervous system that causes you to stop breathing for a period of time. This is a very important, this leads to insomnia because you're always waking up in the middle of the night. Some people don't even know that they have it, and sometimes it'll take their partners being like, oh, like they're snoring all the time, or oh, they're waking up, because people get so used to it. Like you get so used to doing something that you forget that, hey, this is not normal. So that's basic ones. Obviously, no drinking, no whatever, diabetes, all of those are risk factors. However, a neck circumference, so if you got a thick neck, girl, you ain't gonna be able to breathe, I'll tell you that much. Post-menopausal women, male sex, so men are more likely, I guess, so sucks for men. Clinical manifestations of sleep apnea: excessive daytime sleepiness, obviously what I just said, your partner notices insomnia, and morning headaches. I've seen that one a few times, so remember that. Okay, let's go into treatments. So CPAP, you've probably seen this a lot. I have an aunt that does this, but basically it's continuous positive airway pressure, CPAP. So basically you put a mask on, you're sleeping, and it's giving you oxygen, and it's gonna keep that airway open, especially if you have OSA. If something's like blocking it, it's very good. This is the thing to remember about this, is it's positive only. There's no negative pressure, like it's just giving you air. And then BiPAP, there's two different. For this one, you get positive pressure in and negative pressure out, because some people have a hard time blowing against that air. So it says it used in patients who cannot adjust to exhaling against high pressure, high inspiration pressure, or lower expiration pressure. Patients to sleep on their side, because when the tongue gets in the back. Okay, last thing, we're gonna go over sleep hygiene, which means what can you do to make sleep better. So for example, like I said earlier, having a stable rhythm, doing the same thing each night. Cool, dark room. You're gonna see that all the time. It's gonna be like, what can help? And it's gonna give you 4 multiple choice answers, and the answer is cool, dark room. Did I say hot? No, I did not say hot, I said cool. Dimmed lights, not the lights off. You're gonna see a question that's like, a toddler's going to sleep. what is the answer? And it's going to say turn the light off. And you're going to have a better answer than that, because let's use our critical thinking skills. Toddlers are possibly scared of the dark, so you don't want to just shut the lights off. However, that can be an answer if that is the best answer. Do you understand? It's kind of hard. When there's school, it's what's the most correct answer. But I did have a question over that on my last test, and that was not the correct answer, was turning it completely off. It was dimmed lights. Okay, big one is in the ICU. It's very, very noisy with all the machines. ICU is a very intense form of hospitalization. Most of the time they're on a ton of different electronics, lots of beeping going on. A lot of people need to get labs, and so it's very hard for ICU patients to sleep. So interventions that could help is scheduling all of the activities, all the blood draws, all the PT, all the OT in one time frame instead of breaking it up all day, so the person doesn't really have time to rest. Another thing is waking up, turning on the blinds. Again, using your circadian rhythm to your advantage. Turning the lights on, opening the blinds when they wake up, getting that light so that the cortisol can release and that they're awake. Also, big one is exercising in the morning. Exercise in the morning. If you see anything about exercising in the evening or the nighttime, do not pick it. Yes, you want to exacerbate energy and it's going to make you tired, but if you do it towards the end of the day, it's actually going to impair your sleeping habits. So like, just if there is a physical activity one, just make sure it says in the morning. If it's any later than the morning, it is incorrect. And again, no TV, no phones. I mean, obviously like most people do, but in the sake of the test, don't do it. Like, just think of like the best practice, and that's what's going to be on the test. I saw one that was like, if you want to read a book before bed, make sure you do it in another room. So yeah, I guess it's because you don't want the book to be associated with the bedtime routine. Like, you really just want to, I'm not really sure, all I know is don't do it. So just go read in another room, and then when you feel tired, come back. There's another question I saw that was about music, and I actually got this one wrong, because it was like, what would you do? And it had sleep hygiene questions, and the answer was leave the room to go listen to some music. And in my brain, I'm thinking like, there was a better answer, I thought. But yeah, so leave the room, do what you gotta do, and then come back and sleep. See, I only have 15 minutes to yap, so I don't know. I might have to do another YouTube video over just practice questions over sleep and like going through them. So, cool. I'll see you in the next video. See you in part 2, girl. Lock in for your test, girl. Lock in.